We are excited actually about Inotuzumab. We are excited about Inotuzumab in treatment of lymphoid malignancies in the setting of transplant. That's all I do, it's transplant. So I pioneered the first study actually looking at Inotuzumab as part of the conditioning for transplant patients, lymphoid malignancies. We initiated that 2014. And initially we used the regimen in patients who have indolent lymphoid malignancies, CLL, follicular lymphoma, mantle cell lymphoma, etc. We use a standard dose, 1.8 milligram per meter square. And we published this year that the treatment can be done safely without risk of veno-occlusive disease, because we use a conditioning regimen that does not have busulfan or double alkylators. So we use a regimen that has bendamustine, fludarabine, rituximab. And the long-term outcome, now we have 5 years outcome. Survival is very good, it's still 80%. And there is some hint that in patients who have follicular lymphoma, mantle cell lymphoma, are doing better with the addition of Inotuzumab to the regimen. Small number of patients, but there is a hint. So we are very excited. So we took that experience and now we're using it for patients with ALL, acute lymphoblastic leukemia. Not much advance has been in therapy for transplant for ALL over the last 2 decades. So in the setting of transplant, we're excited about the use of Inotuzumab in the conventional setting with ALL, with hyper-CVAD, etc. But we are using now in the setting of transplant, again, to see whether the addition of Inotuzumab can be beneficial and can be used without risk of veno-occlusive disease. Veno-occlusive disease in the transplant setting, reports have shown that there is about 15 to 20% chance of veno-occlusive disease. But we are not using double alkylators with the conditioning. We're using melphalan fludarabine regimen. And so far, the patients that we have treated, they've done well, and they have not had any veno-occlusive disease. We're looking to have more accrual to more patients to be transplanted in that setting in order to have quick data and publish the data and the safety of the use of Inotuzumab in that setting.